So,
that's great.
yes, it's awesome. And then to extend this to different things is really fun.
And I find it fascinating how all these things are interconnected, but really it's common sense. If someone has chronic pain and they're under stress, that would increase their pain, or at least their perception of it could, yes? Do you find that?
Yes. Yeah, interesting thing, if we had a blackboard, I'd show you on the blackboard, but essentially we have stress that happens, and the first thing that happens is we have a thought about that stress. So whatever we think will affect how we feel, because the thought triggers the feeling. Then the feeling triggers the behavior. So we know this happens because we've done research, and so we'll do research and find out how people are thinking, be able to look at the little enzymes that are secreted from the brain, and so we can look at that. And the very interesting thing is that when we have rational thinking, which is really healthy thinking and kind of leads to happier thoughts and calmer behavior, we have certain enzymes that come from the brain that are secreted. And if we have not so happy thoughts and that are irrational thoughts, then we have different types of enzymes. And those stress-related enzymes are the thing that really do matter. So it's our thinking and helping people understand how you think is going to influence how you feel.
Very good, yeah. Mm-hmm. I found it especially interesting that how to reclaim your life is right underneath there. How does someone reclaim their life?
Well, I think one of the things people who have chronic pain might be able to do is to learn how to live in that scenario. And again, the family comes into play. How to interact with your family, and how to be able to incorporate different things in your life so that you have time for exercise, but not too much. Time for relaxation. Time to get out and do hobbies. So that's kind of reclaiming your life, to bring back into your life some of the things that probably were there previously. So we want to see people be able to do things they used to love doing. And that's vital, that's crucial. And sometimes they have to learn how to pace, and they have to learn the intricacies of how to stretch so that they can do some of the things that they used to do. And so it's a process of kind of combining exercise, nutrition, relaxation. We do relaxation, a lot of relaxation exercises, because that can help people significantly, give them tools on how they can do imagery and different things.
This sounds like this all would tie into your course, your class that you give. I believe it's called Power Over Pain.
Use your brain to have power over pain. That's right.
That's great. Use your brain to have power over pain. And this is non-medicated, right? This
right.
is
Yes.
all right.
We're working, of course, with the medical community. I have a lot of people that are referred to me from physicians. They might be on pain management medications, but I'm not involved in any pain management. I'm doing the complementary thing to anything that they're doing with their pain management.
Oh, I see. So this is a associated program with their pain management primary, I guess, physician or something.
For some people it would be.
I see. Okay. So let's talk a little bit more about this Power Over Pain. Is it a course, a class that...
If people had a desire to have me do 4 segments for the community, I'd be happy to put that together, and I think Bay Area Hospital is looking at that as a possibility. Right now, what I'm doing is I'm giving 2 hours away once every month to be able to do this program, and will probably be the same program presented over and over. However, if there were need from the community, it's possible that we would do a 4-segment, and then people could get a bigger overview. That would be really condensing this down into a power-packed program from 10 to 4, but it could be done. My program, once the pro bono thing that people can come to for free, I should mention that it's free, huh?
That's very awesome, and I was going to bring that up,
Yeah.
that you're giving your time, your knowledge, your expertise to the community to help this community deal with its chronic pain issues. And I think that's fantastic. So yes, please tell everybody it's
There's
free.
no charge for this, so please come. It's at the Bay Area Education Building, and it's on the fourth Wednesday very much. Oh, and the other thing we're doing is every other session when we meet, we're doing one session in the afternoon, then the next time we do it in the evening. So we rotate between evenings and afternoons to facilitate different people being there. In the pain program, I'm going to be talking about the cognitive behavioral piece that I just explained to you, probably in a little more depth and putting things on the board. And then I talked about the gate theory for pain control. So there's actually kind of a mechanism in our system on the spinal cord that opens and closes a gate so that we might have some feelings and sensations can come into the body, but there's a possibility that might not go up to the brain, because we might be able to do some things to keep that sensation of pain from going to the brain.
And if it doesn't go to the brain, then
You're not feeling
you're
it.
not feeling it. Yeah, right,
kidding.
right. Mm-hmm.
Soldiers experience this on the battlefield. A lot of times they'll pick up and run down the trail with their comrades because they know that they can't do anything other than that. And they can go through tremendous things with
And block out that pain.
and block out that pain, and they're just driven to go through, because they know that's what they need to do. That's all they can do. If they were stateside in the hospital and they had access to morphine, they'd have morphine, and they would need it for the injury, the extent of the same type of injury. So it's funny how
That is.
the body can do that.
But you bring up a point that I find interesting too. When you get patients in that are on taking painkillers like morphine or hydrocodone or any of these other things, what's your approach to that type of situation?
It would be the same, I guess. If they were taking a pain medication, we would augment that pain medication, and if they're not taking one, we'll give them tools so that they'd be able to we work with both. It's fine.
Would you be geared to giving those tools to people on pain medicine so the pain medicine would eventually lessen and these cognitive tools replace that?
That is what happens a lot of times. That is exactly what we're able to do, is help give people some tools so that they would be able to use their brain to control their pain.
That's fascinating.
Needing quite, be able to titrate down off of medications. And it does happen. It's wonderful when it does, and it does.
And what would you say your success rate on that is?
Oh boy, that would be, you'd need to really look at statistics through research. The program that we just did not too long ago indicated that there was clearly a higher success rate with pain management using a program like Dennis Turk's or cognitive behavioral stress management program. I don't know that I could actually give you a statistic. I wish I had looked it up before I came in here, so I can say 93% of the people. But
Well, maybe on a subsequent show, because I'd like to have you back.
Oh, awesome! That'd be fun.
Absolutely.
That'd be great.
Go ahead.
I'll look it up. I'll write it
Yeah,
down.
I would like to
But
know,
see just exactly.
how successful that is at getting people off of drugs, even prescription drugs to monitor or control their pain, to strictly doing it by the power of the mind and these other cognitive tools or therapies, or I don't know if I'm calling it the right